In rural, war-torn, and impoverished areas of the world, infants are unnecessarily dying at an alarming rate. I am very excited to introduce to you a modest effort to address the worldwide crisis of neonatal mortality. I am the founder and president of Baby Steps, a nonprofit organization aiming to reduce infant mortality that is still in its early stages of about 6 months. My inspiration for Baby Steps came from my experience working in a hospital in rural India where I saw many devastating infant deaths. Many were due to lack of prenatal care, complicated deliveries arriving to the hospital too late, and lack of basic resources for resuscitation. Infant mortality rates in rural areas of India vastly exceed those of urban areas, and this is due in great deal to the disparities in household wealth and maternal education. I was motivated by this experience to address the problem of infant mortality in rural India and started conducting research about barriers to healthcare. I created these educational materials about women's health, prenatal care, and postnatal care in English for the nurses and doctors, and then in Hindi for the women of the rural areas. My proposal involves 3 steps to eradicate preventable neonatal mortality. The first step is providing these educational materials in the language of the areas that we are serving. The second step is creating baby care packages that will provide a sterile and safe start to life. And the third step is research pertaining to outcomes of intervention, specifically measuring the knowledge of the women about maternal and child health care issues and the mortality rates before and after intervention. In the next phase, I plan to work with refugee and immigrant populations in New Haven to learn about cultural barriers to healthcare and country-specific needs for resources and educational outreach. The evidence I have that this program will work is the success I had in my pilot study where I had statistically significant and promising results. And I have continued to supply these materials to the hospital so that they can use them for nurse education and for educational outreach in the community. My desired impact is that Baby Steps will reduce perinatal and infant mortality, first in rural India and eventually throughout underserved areas of the world, including impoverished areas of the United States. An initial board of directors has been formed, including doctors, a lawyer, an accountant, entrepreneurs, and donors who are passionate about taking simple steps to prevent avoidable infant mortality. We already have about $25,000 in funds committed and are in the process of obtaining a trademark on the name and 501c3 status. We will then continue to raise funds through tax-deductible donations. We hope to set up volunteer opportunities for undergraduate students at Yale and other universities to help distribute the materials and gain valuable research experience. I have personally witnessed the significant need to address the problem of infant mortality in rural areas of India and underserved areas around the world. Lack of very basic resources results in millions of infant deaths per year. With the world torn apart by war and political turmoil, refugee camps and displaced populations have become areas of great concern. Even in the United States, where we have the best technology, we have outstanding infant mortality rates. The reasons for avoidable perinatal, neonatal, and infant mortality vary by country and by culture. However, the commonality is that much more can be done and should be done to dramatically reduce these avoidable deaths. My hope is that we are ultimately able to create a program adaptable to every unique culture in order to reduce infant mortality on a global scale. I am very passionate about this topic, and I'm hoping to find a mentor who shares this passion to help me expand my program and make it sustainable. We need the help of experienced individuals to help fine-tune our materials and assist in fundraising, grant, and volunteer efforts. By taking these first baby steps of basic maternal education coupled with basic supplies, which can be provided at minimal cost, I believe we can have an immediate impact and save lives. Baby Steps is a call to action. Your support will help save lives of babies in the U.S. and throughout the world. The time for action is now. Thank you for your support.